Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Okay, Matt, tell me what's going on with your knee. What happened?
I was wrestling about a year ago,
Okay.
and I actually felt no pain the day of. Didn't feel no pain the next day. The day after that, it started hurting, and it's kind of a pain on the outside. I'll get pain right here if I start being active, like running or anything like that. Sometimes I continue to wrestle. If somebody puts pressure on it, I'll get the pain right in here, and the pain stays here. It'll also pop a lot of times. Like if I drag my foot across something, it'll pop in there.
For the whole year you've been experiencing that, or it's getting worse?
It gets better and worse based on
It's
my
back
activity.
and forth. Okay. So how much pain from 0 to 10 at worst? And
At
what
worst-
causes the pain?
At worst four, and I would say the worst pain is when, and I'm a runner, I like to run, so when I really get to running, especially fast, I'll start to feel it on the outside of my knee. So
How much from 0 to 10 at worst?
worst four.
Okay. So if we're gonna do a motion here that aggravated, what can we do? I know we cannot do running here. So squatting.
Yes, squatting.
Okay. So we're gonna use that as way to measure your progress, to your response to the treatment.
Okay.
So give me a little bit history. What kind of treatment you had for during this year?
I've been to chiropractors.
Okay.
I've been to 2 different physical therapists.
Okay.
Went to a massage therapist as well. And no help at all, none of them.
Okay. So do you feel pain currently sitting like this?
No.
No. Okay. I want you to stand up and squat and show me. Like, try to do the motion that actually aggravated.
Okay.
And tell me how much from 0 to 10, how much pain.
Right here, it's probably a 2 or 3.
Okay.
It feels like it's about to pop.
Okay.
Did you hear it?
Oh, I heard that sound. Did you guys hear that? Okay. All right. So 3?
Yeah, about a 3.
Okay. So I actually will have him go down and up 10 times. And we're going to use it 10 times for re-evaluation. Okay? And you tell me if your pain increase or decrease or what's going on.
Okay.
Okay? You counting?
2.
Okay. If you're not counting, we're going to do 200, okay?
Yes, more.
We're going to be forever here.
It is increasing.
Okay.
It's actually kind of coming around the bottom side of it as I'm going.
7. Come on, Matt.
8,
Mm,
9,
10.
10.
how much is increasing now? When
Probably a 4-ish, 5-ish.
Okay. Is it sharp, dull, aching? How you describe it?
More sharp in here and dull around the backside here.
Around the back. Have you had any MRI or
No.
anything? Okay. All right. So we'll have you lie on your back, head over there.
Okay.
So I'm gonna work on his knee here. And relax. Okay. So you feel it right here. Okay.
Yes.
Make sure everything pain-free. Okay.
Okay.
Okay. You guys feel free to ask questions if you have any questions. Okay. I'm doing this sequence for a good purpose because that's what I show it to you. It's not a secret. So, is that painful?
No.
Okay. So all your pain just around this area, it's not really going anywhere else. Okay. Let's actually review that day that you were wrestling. Did you have any like, wow, that's hurt my knee?
No.
Did you fall? Did you do any twisting like, wow, this is not
I don't remember
comfortable?
I didn't think I was hurt until
Yeah, it's just the next day?
2 days later.
2 days, yeah. A lot of the time, actually, with injury, people feel it afterward because their system calmed down and they start to realize, wow, I injured. It could be a day after. Do you feel like your knee buckles on you?
No, but pops. So
Pops.
There's a popping in there.
Your patella pops?
I don't know. So it
Like
feels
this
like a
bone?
tendon's popping over or something.
Which one? Where? Where do you feel it?
Kind of on this side of the kneecap.
Outside or inside?
Outside over here.
So outside, you don't feel something inside flipping or locking or anything.
No.
So I'm asking question to see if, like to help me to know, is there any ligament integrity issue here? The meniscus, the lateral or medial collateral ligaments, but he says it's superficial, it's outside. So he's pointing a lot of here and here in this area. So I feel his IT band, and there is a lot of fibrosis on the scar tissue here and fascia restrictions. So I'm gonna release it. How's that feel?
It doesn't hurt.
Okay.
No pain.
No pain. Okay. Actually, his fascia is really good. Really good compared to the injury. In general, actually, you have a good fascia everywhere, you know. A lot of patients you will feel like really very restricted fascia range of motion. This is really almost close to normal. So, okay. I will actually, I should have done this. Okay, well, we'll do it in a little bit, we'll see. I just want you to take your shoes off and socks off. We'll have you do that after I do this first.
I can feel it right there.
You feel that? Okay.
Yeah.
Do you guys feel that? The correct answer, yes. Okay. Too much?
Right at the end.
Okay, make sure it's not painful.
Okay.
You see what I'm doing?
Just a little bit of pain.
Okay, what about now?
None. It's okay now.
You see, I'm sweating here. Not really. It's just very easy when I use the A5. It's actually not much
No pain.
effort from my part. It's okay now?
No pain. No.
Okay. So I did some release, and then actually I tried to see if I can go further. How's that?
Just on the edge of pain.
Sorry, okay, what about now?
No pain.
Okay. All right, I did this. Do you have any issue in the back of your legs?
I don't have any pain in the back of my legs.
No, okay. This is a big one here. You feel this one here? Okay. Oh, okay. I'm glad you did not say a word, okay? He said, oh, that's it. Wasn't bad. How's that?
That's okay.
Okay. Okay, so I'm gonna work on scar tissue. Let's take your shoes off and socks off, okay? Sorry,
It's okay.
you see that?
Yeah.
Stuck. Yeah, stuck. Look at the normal area. See how nice and smooth? Look here. I have to really push it to move over the scar tissue. And you're gonna see redness where the scar tissue, and I will show it to you after. Just clean it up, clean the lotion in here a little bit. And look at here, in the same area that I worked with the A5. The same spots. I felt it with my hand. You see? Can you see it?
Yep.
Yeah, sometimes I was thinking, should I put the logo of ASTR here so when I put it, so it will be on patient for the rest of their life? I decided not to do that. That's a lawsuit. So, but even that, you know, the impact of the tools, it should disappear in 10-15 minutes because we do everything gentle. You know, they should not come next session. Oh, wow. Yeah, you did tattoo here. You know, you had tattoo. Okay, and don't put the lotion inside your mouth, okay? How's that?
No pain.
Okay, so I start to see redness here. Gonna do it very fast now, not explaining thing. It's fine here, look at this. Not bad. So can you compare?
Yeah.
And you will see the scar tissue, it's like red spot. Yeah. It's not everywhere. Some patient actually you will see it like the whole thing is red. That's mean that's all scar tissue. But here, and I will show it to you when I clean it here. Look here. You see? You see the scar tissue? It's the redness, and everything is normal skin color, you know? So that's fine here. So I'm gonna, this is fine, so nothing to do here, okay? So I'll have you flip over, okay? Oops, we'll put this legs. So I'm gonna go to the other side. So did you see how much time was? Okay. So hamstring is an issue to a lot of people, okay? And I'll show you that. Okay, I cannot see his face, but make sure you communicate for me. Okay? Too much?
No, it's fine now.
Okay.
I don't want to take.
Okay. His calf is actually not too bad, but here. Okay. And did you realize his pain where there is a scar tissue and fascia restrictions? So you see my body mechanics. Okay. Here, there's more here. How's that?
Okay.
Okay. Because I just flip him over, I did not use the other tool, so I have to come back with the other one, and I will show you which one. Do you have any plantar fasciitis or any issue here?
I have in the past, but I haven't for a long time.
Okay. Is that ticklish?
It doesn't bother. No, it's not ticklish. But
Okay. If it's not ticklish, do not treat it. It's only ticklish, okay? How's that?
on the bars I want to put.
Okay. Just make sure you tell me, okay?
Okay.
Here.
Okay.
Okay. Here.
Okay.
Here.
That's hurting.
Sorry. Okay. So you guys can see the map of the scar tissue here. Look here. You see that and this. Okay. This is a little bit scratched from the edge, but this is a scar tissue. You see that? A little bit here. But everything else, look, it's a normal color because I did the same pressure everywhere. Okay? So let me do the other things. Okay. Relax. But do you see, I'm gonna palpate now. So this way, relax. So you visually can see it in here, okay? So I feel a band. Feel a band here. Okay? Is that too much?
No.
Then we rest. Too much?
No.
Okay. How's that?
It's okay.
All right. Relax. You okay?
Yeah.
Okay. Well, in real life, you need to have a higher table than this, okay? I did not realize this is low, so you don't hurt your back, but otherwise squats like this. So I'm doing my workout now for the day. How's that?
Okay.
Okay. Or if it's too low, I'll just do this. Feel that here? Okay. Relax. Okay. So, do you guys, I'm not going to say the protocol or the sequence. Did you realize what I did the entire thing. Okay. So I'm gonna finish this up, and I will have him do the squats again. We did 10, so that's my baseline. And the purpose of doing 10 to oh, no kicking, okay? Make sure you don't kick, okay? We have it in the camera, it's documented. Okay, so the other thing, you know, make sure the patient do not kick the therapist, okay? Tie them down, no, don't do that, okay? So, yeah. And the other thing to protect yourself is just a way of kickers. Get on this side, not in here, because it's gonna hit your face. Okay. You see my fingers?
Yeah.
See that? Sorry, is that painful?
It is.
Okay. So his pain where the scar tissue or fascia restrictions. Make sure it's not too much, okay?
Okay.
Because the table low, I'm just gonna use this direction. How's that?
It's okay.
Okay. Actually, when I have him turn over, you can see the redness should be start to disappear. That's mean I did not overdo it. We don't want to cause inflammation. Is that painful to you?
No, I stood on her toe.
Okay, sorry. No, I said so. That's funny. Sorry. Okay. Is that too much?
No, that's okay.
Okay. Just look for the spot to get in. How's that?
A lot.
So you see, it's like when you get to where he has tightness, so he might have localized inflammation there. So we did 10 times and your pain level was?
4 to 5-ish.
Okay, and it was increasing. Okay, so we're gonna do 10 again. If you start feeling pain, just let me know.
Okay.
And where do you feel it?
1 on the outside.
Okay,
2, 3, 4. It's increasing a little bit.
how
5,
much from 0 to 10?
Maybe 2.
It's all on the outside?
Yes, all right here.
Okay, let's lie on your back. It increased to what number?
2.
2, okay. It's right in here?
Yeah.
Okay, let me know if it's too much.
Okay.
Relax. You see what I'm using now?
Yeah.
Okay, relax. And I will show you the scar tissue here. I should have done this, but it's okay. We'll back to it. You know what I'm doing now? I did not do that initially. You remember? I just did the muscle. I did not do this. But too much?
No, it's fine.
Okay. He has a scar tissue. It's not too much. You remember the grain? Sand? A lot of sand here. Not really. There's no sand inside him. It's just scar tissue that feel like sands. And look at the redness.
Yeah.
See that?
Yeah.
Okay. I'll show it to you after I clean it up. So the great news is actually with these tools you can feel the scar tissue. You feel the vibration. Patient can feel it. And actually you get a visual afterward of the scar tissue, the map of the scar tissue. And we can see the map here. Okay, you guys come closer and see where he has. Oh yeah, he has more scar tissue. Is that could cause pain here?
Maybe, yeah.
Yeah. Compensation,
Yeah.
pulling. Is that gonna cause patella tracking unevenly? You have more scar tissue, you're going to pull. You know, he has a scar tissue here. It's not as bad, but he has it here. You see this?
Yeah.
Nothing was there. And when I did this area, it was okay. It was in here, but I did not do that. So let's have you squats again, but before that, we're going to give him just a regular water. Okay, so give me numbers, okay? You guys can count. He's going to give me only the number of the pain, but someone else count.
1, 2, 3, 4,
Maybe a 1.
Okay.
6, 7, 8, 9, 10.
It went back to a 2-ish on the outside.
Okay, let's drink more water. What else I should do now?
Outside.
Yeah. What should I do?
Maybe the Magna Hill?
That's correct. Let's line your... Let's drink some more water. So he did the 10. His pain was going 1 to 2. It's not the 4. And if you notice the speed of the movement, it was a lot faster, very smooth, okay? And he started to say 1 late or 2 was late at the end, okay? So that's what we look for, the speed of the movement, the quality of the movement, and when the pain starts to kick in, okay? If he did not have inflammation, do I expect pain? He should be okay, all right? But because he has inflammation, and visually you can see it, okay? Let's have both knees together, and you can see. Look at the swelling visually. You can see the swelling here. There is no swelling here. So I don't expect it's going to be 0, but I will do my best to get it to 0 now. But we need to really work on inflammation. You can see all the fluid in here. So I'm using the Magna Heal to work on that, and I will give him the Magna Heal to use it at home because that's a really very obvious swelling. He probably will need to use it for a few days, you know. And your pain when it came back here or here?
On the outside.
On the outside, okay. But I'm not really surprised that it's painful because the visual swelling that he has. So that swelling in the way of everything, you put too much pressure on a swelling area, it's just gonna send the pain signal, okay. How does that feel?
No pain at all.
Mm-hmm.
Almost feels a little cold.
It's cold, yeah. Well, it's a magnet. So it has anti-inflammatory coating, and because it's metal, it just feels a little bit cold, which is okay. How does that feel?
Feels fine.
Mm-hmm. So is the size of the pain, is it the same or a little, or different?
Less.
So it's shrinking a little bit? Where is the exactly spot?
No, well, I don't have pain when I'm just sitting
No,
there.
when you
I
did
was
the
down
squats.
The outside.
The whole thing?
Yeah.
Okay. All right. Okay, we'll give you more water and I will have you squat down. How much time did I do this now?
This is 4 minutes. Maybe 3 minutes.
This is 3 minutes? Okay.
No, I think 2 minutes.
Yeah. Okay, let's drink some water and squat again. So someone count and he gonna tell me only the pain from 0 to 10.
1, 2, 3, 4, 5,
A 1.
6, 7, 8, 9, 10.
Okay, feedback.
A 1. Just a 1.
Okay, I'm happy with that because I know there is inflammation. There is no, we have to get the inflammation down. So I will give him the Magna Heal, take it home, use it for a few days, and you visually can see the swelling. When the swelling is down, that should be good to go. Questions?
Thank you.
Yeah, yeah. So, okay,
Seriously, thank you.
you're welcome. So you had physical therapy, you had chiropractor, you had massage.
Yep.
So can you tell a difference between ASTR and what you had before?
Those other things didn't help me at all.
Mm-hmm.
So
Yeah.
this helped.
Yeah.
I'm I'm excited.
Yeah, awesome. Thank you. Thank you so much.
Thank you, Doc.
Thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.